Panhandle. That's court-appointed special advocates. Good morning and welcome back, Michelle.
Good morning. Thanks for having me.
Great to have you here. Yeah.
Thank you.
So I know that you've been watching what goes on in the state legislature. I know you've had some meetings with some folks in regards to the laws that could affect or positively or adversely what you folks do at CASA. Can you tell me how your meetings have gone and what legislation you're particularly watching?
Mm-hmm. Great. Yes, I was down in Charleston, and really we had a productive 2 days. I worked very closely with our state director. We have about 9 CASA programs across the state, and we have a director who does a lot of the advocacy and coordinates for us. But, you know, folks in Charleston are sympathetic. Who could not be sympathetic to the work of volunteers working with children on abuse and neglect issues? Really, we are the one person, the people who help stabilize, children in tumultuous times. And people care about our work. I mean, people understand there are gaps in services and the public system isn't working for these children. So we are stopgap, and everyone supports us from policy making. But the proof is in the pudding because we need money. And we can't do the work we're doing solely based on volunteers. There's training we do, there's recruiting we do. We support every single volunteer who works with us, so staffing is needed, and we need to pay people living wages. So we need funds.
And did you get some positive response to the effect that you're seeing legislation moving through that could help?
We have a budget line, so we're happy about that. Let's hope it stays in. We also are, the state supplements federal funds that have been decreasing, so we hope that stays in. We care about education funding, and we know that's declining, so we're fighting for that as well. We're fighting for community resources across the board, including mental health issues, so mental health resources, so we'll see.
And so you've been in touch with the state officials. Have you been in touch with the federal officials too, the Senate and the House?
We at a local level don't work on those issues. We are part of a national association that works with, on federal issues. The only guidance we've had is to take out any mention of diversity in our grants. It's been a language thing, not necessarily a work thing. And at this point, we're sort of waiting for the shoe to drop on funding, but nothing so far.
Bill?
Michelle, good morning. You've been talking with the folks in Charleston. You said money is something you've been addressing. What about bills specifically? Are there any bills that have come through the system that are going to be passed this year that would directly impact you?
We're watching a lot of bills, and I think there's bills on timing when children should be removed, visitation when they need to see their siblings, or foster parent responsibilities in seeing siblings. So these, I want to kind of say, will it impact us? I mean, these are a little bit fringe issues because we follow the law. And we work with DHHR, who has standards and policies. So some of this is a little ancillary to our day-to-day work. There was a bill that, is about child removals in classrooms, and where we, obviously we care about the safety of other children and, the safety of teachers. We do want to make sure there's mental health resources for kids who've experienced trauma. I mean, these abuse and neglect kids are in schools and in your classrooms. So how they're cared for, we care about. So,
when you were in Charleston, did you meet with the Secretary of Human Services, Alex Mayer?
No, I did not.
Okay.
We were meeting with delegates and senators, and I almost met with all of them in the Panhandle, and that's a lot.
Yeah,
we do have a bunch.
Yeah.
Mr. Gilstrap.
I'm on your website, and I'm looking at the the duties and responsibilities one more time. There we go. That's pollen, folks. And I'm seeing what a special advocate does. It creates a fictional child, Cody, who's paired with Jack, the advocate, and Jack does a lot of constant presence while working with the parties that are involved with Cody. Collaborates with child welfare team. Helps connect him with his caregivers, meets at least twice a month, provides support, identify emerging family needs. then writes a comprehensive report. So this is an immersive job for the special advocate.
Yes, it is. Volunteers tell me that this is one of their most intense, not only volunteer experiences, but professional experiences, but also the most rewarding. So I think we are really finding people. We have over 70 volunteers. We just graduated a class of 10, our biggest class ever.
Congratulations.
Yeah, very exciting. And these are individuals who have a heart for children and are willing to spend the 10 to 20 hours a month to do all of those things you said.
And what is their caseload?
Typically one family, so they might have 3 children in the case. Some, we have superhero volunteers, retired, and who can take on more, and that's amazing. We have some volunteers that have 3 cases. So typically they work one case, one family. Usually they take a break, then they come back on. On average, most of our volunteers stick with us 2 to 3 years, but we have some who've been volunteers for 15.
And when, for any given child, when is their job done?
It is done when the case closes. So when they find permanency. And that means either they were reunified with their families, they fostered care to adoption, or, our older youth sometimes are in congregate care, and that just becomes their permanency plan. In those cases, our volunteers and or our staff stick with them until they age out. And that's a real priority for us.
So congregate care is a group home?
A group home.
Okay.
Correct.
And the average age of the child are they small children, adolescents, teenagers?
Well, we prioritize. There are over 1,000 children across the Eastern Panhandle, Morgan, Jefferson, Berkeley, in active abuse and neglect cases.
1,000?
1,000. At the end of last year, there was nearly 1,000. We served 450 last year. That's amazing. That is volunteers, staff, our youth programs, but that's only half of the children who need us. So when we advocate for money and we talk about these things, there's real need in the community.
And the average age, they skew toward infancy?
Yeah, sorry. So with our ability to not serve every child, we focus on the children who need us most, and those are older children. So we prioritize those children 13 and over. I think they are highest at risk for a whole lot of bad outcomes. And they're harder to place in foster care. They move around more often, and we're prepping these children for young adulthood and providing the mentoring and support they need. Infants, a little easier to place, shorter cases. The older a child gets, the harder it is.
Michelle Sudduth is our guest, Executive Director of CASA of the Eastern Panhandle. Bill, you look like you had a question you're about to ask.
Yeah, I do. I was looking at your webpage, and I must be confused. I see children served over 5,000. That must be statewide. Is that right?
Yeah, that's over our 20-year
Over
history.
a 20-year period.
20 period.
Okay.
We were celebrating our 20th anniversary last year.
And it shows that you need something like 300 volunteers, which is a huge number. How do you recruit a volunteer? I know you appear on WRNR occasionally,
Yeah.
and you're very active in the community. But how do you aggressively recruit a volunteer?
Well, like you said, this is very helpful, so thanks for having me. We always get a call or two. We are aggressively using social media and probably, doing this super professionally now for the first time this past year. But I'll tell you, when you look at our how did you hear about us data, it is from someone they know. So it is a board member, it is a staff member, it is a neighbor, it is someone talking, they met at a training or they met at a Chamber of Commerce event. So the one-to-one awareness building and having people deeply understand our mission and be able to talk about it really, I think, makes it happen and puts people over the finish line to volunteer.
How rigorously do you vet a volunteer? There's certain folks you do not want in the program. How do you identify those people?
We interview every applicant, and every trainee is background checked. So they go through fingerprinting, DHHR background checks, and local background checks. So they're thoroughly vetted.
Yeah, I know 3 or 4 that are in the CASA program, and they literally dedicate their life to this program. They feel so strongly about it. And it's hard not to feel strongly about it because you're providing a need that's not been addressed anywhere else, and to an extremely vulnerable time in that child's life.
Yep, that's absolutely true. Next time I come, I'm bringing a volunteer.
That'd be fun.
Maybe one of your friends.
Yeah.
Yeah,
Okay.
because they tell it better than anyone else can. They're really amazing people who do dedicate themselves to
they
this.
do.
And we pay a lot about retention and how do we support these volunteers, right? Making sure that staff are right behind them, giving them the support they need.
What-
Because this is tough.
Michelle, what differences, if any, have you observed in being able to get any information, get things done, meet with the right people since the reorganization of Health and Human Services in West Virginia?
Well, there's more staff, so that's a really good thing. And, I think it is about making sure these staff who are really doing amazing work on the ground keep their job and are retained and are managed professionally. So I think that's the key. We're just waiting for a little bit more of the turmoil to stop. But things are better.
And you have you've been around long enough that you can compare it to the way it was before
Right.
they broke those up.
Are they is it perfect? No.
Right.
I mean, it's just not. It's a really complicated bureaucratic system, and staffing and human resources are really tough to secure.
Have you met with Adam Burkhammer on the House of Delegates?
I might have missed him.
He's a foster parent and has done
yes, I have.
a lot of work
Yes, I have.
legislatively.
Yeah, that's amazing. I think 2 people I met with foster children and really have a good idea of what's happening. It's amazing.
Let's go back to legislation very quickly. And if you were queen for the day, and not looking at CASA per se, but looking at our overall child welfare program, what do we need more than anything else?
I mean, it sounds like, Michelle, come up with a better answer. But we really need financial resources. I mean, people need to be paid a living wage who work in these sectors. There needs to be more mental health services in communities. People need to pay attention to trauma and what that has done to our young people, and understand that it's not just the 1,000 children who are in active abuse and neglect cases. There's another 1,000 below them that are couch hopping and just not involved in the system, but are living very vulnerable lives through no fault of their own. I mean, the opioid epidemic was a huge hit, and that's going to impact us generationally. Poverty is real. These families need support. So,
We've been hearing this for several years now. Maybe the numbers have changed, but the concept or the need has been there. And we always hold out a element of hope. Either we reorganize DHHR, that's going to address the problem, or we have a new director on the governor's secretary looking at this problem. So there's always hope, but yet the problem is never resolved. When you were in Charleston, did you get a sense from talking to legislators there is a real desire to kind of look at the kernel of this problem and get to the basics and to solve it, besides just throwing some dollars?
There's just a lot of juggling, right?
Yeah.
And it's politics and it's messy. So when you say it's like making sausage down there,
Yeah.
it's like making sausage down there. And I think there's a lot of things that folks are paying attention to, but it's a juggle. So, I don't know. I hate to sound like a pessimist because I'm an optimist, but
It's a tough situation.
it's a tough situation. And no, I do not see it getting better. And, even on an ancillary note, I was having dinner with someone and, her the position she thought she was going to have as a mental health, social worker in school was eliminated. So instead of adding positions that are needed, they're being taken away.
That's not helpful.
Let me ask one more kind of question, or I guess a statement on my part. My sense, and you're much closer to this than I am, my sense has been in the years past, and probably currently, a lot of concern and consideration, but it has never been the number one priority.
I would agree with that.
Yeah.
I would agree that it's shocking, but I don't think the state of West Virginia pays enough attention to children. And data supports that,
Yeah.
right? we can look at the rankings and know that what I'm saying is true. So how that changes, I don't know.
How many other nonprofits do you interact with? If there's a child in CASA, there's a chance that child is also being overseen perhaps by or helped by several other charities along the way too, correct, or nonprofits?
Yeah, I mean, we work closely with the Martinsburg Initiative. They put social workers in schools. We do a lot in education advocacy. We hired an education advocate because, families need support. If grandma's taking care of the child, she needs to understand what an IEP is. And, getting these children through school and graduating is like our number one priority. So, organizations that support that we will work with, tutoring organizations, mental health providers. We try to connect these children with resources as much as we can.
Is there a mentoring expectation from CASA volunteers in terms of not just helping the child with their math issues, but also helping grandma with getting through that sort of thing? Are they also family counselors as well as child advocates?
I'm so glad you asked me that question because on my little notes was the mentoring program. So you all were asking me about the intensity of being a CASA volunteer. And just this month, we are launching a mentoring volunteer track where we're asking community members, folks who maybe can't take on the role of a CASA, court-appointed special advocate, to be our mentor for our youth 13 and over. So the job is less court-related, no reports, but really taking mentorship to its fullest. And how do you make sure these young people have the life skills, the educational resources, yes, the tutoring that they need to thrive, and how do you support that family? So yes, absolutely. And we found that, this is a real need for us. And I think it's going to be a great way for us to bring in new community members who, are skilled at different things and don't have to make that sometimes heart-wrenching commitment.
Sort of in the sleeve of, maybe it doesn't exist anymore, the Big Brother, Big Sister program of old?
Yes. Well, Big Brothers, Big Sisters does an awesome job. And in our Fostering Futures program, we bring our children together in the same way. So the same way, providing monthly programming. We do a leadership summit at Shepherd University where we're going to have 25 kids in foster care attend this year, which is amazing. We started out with 5. But yeah, it is the same. And the difference for us is all of those children have a shared experience. They've all been pulled from their homes. They're not with their parents. And for them to know each other, to see the cohesion that is coming together from this group of, 13 through 18, so big age gap, is amazing. They take care of each other. They are Facebook friends. It's really an amazing thing. I hope they have lifelong support from this group.
Yeah, the mentoring program is very exciting. Glad to hear about it. Have you been to service organizations such as Rotary? This is something the Rotary has been involved with, not the mentoring program, but something similar to it over the years.
Yeah, we just presented in Shepherdstown, so we look for any opportunities to present. And my team, I have a great staff. We have volunteers who come out and talk about their work. So we just presented at Rotary. The Martinsburg Rotary did an amazing job. They actually funded a family child visitation area. So we were asked by judges because there was no supervised visitation area. So the state was removing children. And part of reunification is you have to have visits. It was a 6-month waiting list to bring parents and children together. To me, that's like criminal. Yeah. So we stepped up. The Rotary helped us. So, it's amazing what community can do. And we have this amazing space that looks nicer than my living room.
Michelle, before we run out of time, what fundraisers do you have coming up in this spring-summer season?
Well, mark your calendar for September 6th. That's our gala. So that is going to be super fun. But before then, please stay in touch with us. Like us on Facebook. Our next training comes up in May. We are running our first mentorship training. So I encourage people to visit www.mycasaep.org to look for more information. Or just give us a call and sit down with one of our staff members. And the phone number is 304-263-5100.
Do you do the Superhero Challenge any longer?
Oh, we need volunteers to run that for us.
Oh, so
if anyone is interested in organizing a superhero run, we'd love to do it.
Yeah. Did you do one last year?
No, we didn't.
Discontinue
No, we
it?
didn't. It's volunteer. We need volunteers, and we got too busy taking care of kids. So some of this stuff is hard for us to get out and do. But
Sure. But if you're a volunteer, you don't necessarily have to be a CASA to volunteer for
No.
CASA. So that
Right.
there
Thank
are
you.
two separate categories.
there are a few categories. You could be a CASA volunteer. You could be a mentor. You could volunteer and be on our board or one of our committees. Help us fundraise. Help us build awareness. Invite us to speak at one of your groups. So lots of ways to help out.
You mentioned 1,000 children in the Eastern Panhandle that you're overseeing.
The court system is overseen.
Court system, okay. And then is there another? You said another 1,000 undercounted because they're not being reported and going through the system.
That's my personal
That's a
estimate.
guess?
But yeah, so for every, there are 200 calls for suspected abuse and neglect every month, right? Not all of them get investigated. Not all of them get the resources they need. But obviously, they're in super vulnerable situations. So one of the things we didn't talk about, we'll talk about next time, is prevention. I mean, how do you put the resources to not take kids out of their house, right?
I have about a minute and a half if you want to touch on it real quick.
Well, I think this is where we have to move. I mean, we have to put more resources into vulnerable families and not have them enter the abuse and neglect system in the first place, because the odds just get worse for those children. So the state needs to think about prevention. We need to think about it as a community and help our neighbors and, really be out there. We see the vulnerable families, so we need the support.
Are many of these families getting Medicaid benefits? Are you aware?
Oh, and that's one of the things we help people with, right? When you said in mentoring, making sure they have the public benefits that they need. We're starting a new program that is going to help keep people post-permanency. This was actually a WISH grant that we got from Shepherd University, is how after permanency, when typically CASA would end, how do we stay on the case for 6 more months to give that family the kind of support they need, like Medicaid, like IEPs. So we're excited about this test run on this program and grateful to the WISH folks.
And again, Michelle, how do people get in touch with you to help?
Well, first of all, if anyone is really interested, I'd love an email. Email me at michelle@mycasaep.org or give us a call at 304-263-5100.
Thank you for coming in.
Thank you so much for having me.
Good to see you again.
Yeah.
Michelle
thank you.
Sudduth
Thank
from